again.
Hi there.
So I want to talk to you about the gabapentin because you use that for many years, right?
Yeah, gabapentin has been around for a long time. More recently, it's become a controlled drug, which means that it requires that the doctor not only fill it in a specific way, you can't write it on your regular prescription pad. You've either got to prescribe it electronically or use a special pad that is multi-part, where you keep a copy and it gives a copy to the pharmacist besides one for the patient to bring in. Gabapentin has been used for neuropathy, and it's one of the agents to be used for neuropathy. And just a little bit about neuropathy in general. Neuropathy is the name given to a painful condition that affects our nerves.
Yeah.
And there's a number of causes of neuropathy. Diabetes is perhaps the most well-known, but some vitamin deficiencies can also cause neuropathy. And then there's a whole category or group of people who have neuropathy that we don't know why. They're not diabetic. We can look at their blood levels of various vitamins or everything, and they're normal, but they still have neuropathy. And like any illness, it's a spectrum. Some people are mildly effective, and other people, it's, say if you're looking at the feet, every time they walk, it's really painful. They can lose sensation, and it is a really potentially uncomfortable condition, so you want to treat it. And gabapentin and another drug, a derivative called Lyrica, have been used for many years. And some people do respond to the drug. Not everybody, but the trouble, there's no medication that is totally side effect free.
That's correct.
And if you look up aspirin, you'll see a lot of side effects, and people have been sort of a little facetious in saying if aspirin today was a new drug and it came in front of the FDA, they'd have trouble getting it approved. Or ibuprofen. There's a lot of side effects. That aside, part of the problem with gabapentin is once you're on it, really hard to stop it. They have a withdrawal syndrome. And so you've got to taper off it. You don't abruptly stop a medicine, or that particular medicine.
Yes.
You know, if I put you on a medicine for your blood pressure and it wasn't working and I switch you, in most cases, you just stop it and you move on. Gabapentin, you have to come off slowly. Gabapentin can actually cause some psychiatric problems in people. It can interact with narcotics in a negative way, but can also cause you to get a false sense of anxiety, of sort of security. And so it is a drug that I would guess I respect it. Not that you don't use it. Any medicine, you use in the lowest dose that's going to work. And if it's not working, you tell your patients, okay, we're going to taper. In this case, we're not just going to stop it abruptly. We'll taper it down, and we'll look for an alternative which may help you.
Yes.
And if unfortunately for neuropathy, that's one of the conditions where actually, as you know, acupuncture is, if you look up in any of the medical references, is a suggested form of treatment. There are other treatments. So medication is not always the best treatment for a condition.
I think it for like acute symptoms, and it really reduce the pain or numbness, right?
Right.
But do you think it can help improve the circulation so the nerve can regenerate?
Gabapentin?
Yeah.
No.
Yeah.
I don't think that's ever been shown. You know, one of the difficulties, and that only doesn't relate to this, is if a study comes out and there's a suggestion something can happen, some people pick up on that and they generalize.
Yes.
And just because there was a slight improvement, it doesn't mean it's going to work for everybody.
Yes.
We have to do the studies which say, okay, there's an indication this may happen, but what about the next study? Because some medications which we thought may be effective, turn out not to be that way.
That's right.
You know, I mean, one of the reasons why it's so expensive to bring drugs to market is the fact that you've got to do large studies with a large number of people over a period of time. And even once all this goes on and a drug is approved, we find that once a drug is approved now, instead of 2,000 or 3,000 people using that, which would be a large study, suddenly it's opened up to the entire United States.
That's
10,
right.
20, 30,000 people start using it. And we find out new side effects
Yes.
that were not as shown in the smaller sample we had.
That's right.
And
yeah.
I can tell a story of a patient back in Massachusetts, it happened to be a drug for asthma, not, we're talking about gabapentin, who had a problem. It was a new drug, he was having trouble with his asthma, I gave it to him, and he came back with blood when he went to urinate. That had not been reported.
That's right.
It turned out that that was indeed a new side effect. So like any medicine, once it comes out, we still have a lot to learn. And occasionally, you know, people realize they stop a drug.
Yeah.
Does the drug come out and they say, no, we didn't realize that there is a potential very serious problem.
That's right.
So gabapentin has its place. It's not a drug that, you know, shouldn't be there, but properly used, lowest possible dosage. And if you're not getting a benefit from one dosage, maybe a little bit of an increase, but if you've increased it a bit and you're getting zero benefit, to keep pushing it higher and higher only sets you up, in my mind, to a potential problem rather than a benefit.
That's such a wonderful comment. Thank you.
You're welcome. There we go.
That's wonderful.